Not all viruses cause disease. Some viruses can provide benefits to their hosts. But when a virus infects a 3-month old, he'll be lucky if he makes it out alive. When Capri left for school this morning, her 3-month old son was wheezing a bit and he had a slight fever of 99.8 degrees Fahrenheit. Her mother is watching him while she goes to school to take her anatomy and physiology exam.
Mom, thank you for keeping the baby while I go to school. Okay. Hi, baby.
Her phone goes off halfway through the exam. The baby's fever is rising and he is having more trouble breathing. Her mother says she's taking him to the emergency room, and Capri rushes right over to the hospital.
Hello? Hi, Mom. The hospital? Oh no. I'm on my way. Okay.
When she gets to the hospital, he's in an examining room and the doctor is signing papers to admit him into intensive care.
He's not gonna go out. We should probably get him to the ICU.
The doctor says that he suspects some kind of pneumonia. He mentions the type of pneumonia, but Capri doesn't recognize the name, and she's too worried about her son to pin him down at that moment. Capri does note that he mentions that the hospital has seen a dozen pediatric cases of the same type of pneumonia in the past week and a half.
He has blah 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 pneumonia. I've seen dozen cases in the past week.
The doctor swabs her son's nose, but says the results won't be back for several days. In the meantime, they will give him supportive therapy, including an inhaled spray, but no antibacterial drugs. The doctor says that he feels sure that the child will recover since the infection was caught very early. Nonetheless, after he leaves, Capri's mother is frantic and indignant. She fires off the following questions to Capri.
What is it?
What kind of pneumonia is it? The baby is suffering from a viral pneumonia caused by the influenza virus. Pneumonia is an infection of the lungs. Viral pneumonia is a lung infection caused by respiratory viruses such as influenza, RSV, and even the common cold.
Why not give him medicine?
Why aren't they giving him antibacterial drugs? Doctors are not giving the baby antibacterial drugs because bacteria are not the cause of the pneumonia. Giving the baby antibacterial medication would be an unnecessary use of these drugs and would add no benefit for the baby.
It's the purpose.
How can the doctor be sure what's causing the pneumonia if she doesn't yet have the test results? Although the doctor does not have test results, she can diagnose and treat the infant by using other variables such as age, epidemic situation, and clinical profile. Point 1. A patient being younger than 5 years old suggests a viral cause. Point 2. The doctor's admission that the hospital has had a dozen cases in the past week proves ongoing viral epidemic, which also suggests a viral cause. Point 3. The patient's symptoms, wheezing, also suggest a viral cause.
What is it?
What about your other child, who is 3 years old? Has she been exposed to the infection by being around the baby? Should the baby remain isolated when he comes home? Can the 3-year-old be vaccinated? It is possible that the 3-year-old child has been exposed to the infection through physical contact with saliva or aerosol droplets from the baby's coughs or sneezes. The mother should try to keep the siblings separated until the baby's symptoms have subsided. This would be helpful so that the older sibling does not get sick, and also so that the baby isn't introduced to other pathogens while his immune system is compromised due to his current infection. The 3-year-old daughter can be vaccinated for the seasonal flu each year. Pathogen profile. Name: viral pneumonia caused by the influenza virus. Type of pathogen: a lipid membrane enveloped RNA virus. Special structures for pathogenicity: spike proteins, hemagglutinin, and neuraminidase. Major signs and symptoms: fever, chills, fatigue, wheezing, and shortness of breath. Mode of transmission: mainly spread through aerosol droplets from a sick person when they cough or sneeze, or contaminated fomites. Method of treatment, control, and prevention. Viral pneumonia is typically treated with supportive care or supportive therapy. For example, rest, fluid hydration, fever reducers. However, when caught early, viral pneumonia caused by the influenza virus can be treated with antiviral medications that inhibit influenza neuraminidase activity, such as inhaled zanamivir. According to the CDC, children and adults 6 months and older should get an influenza vaccine every flu season. Hand washing, coughing and sneezing into tissue, a sleeve, or the elbow, and disinfecting surfaces that are touched often can also prevent the spread of this condition. This is a photo of an influenza A virus, which are named and classified by their hemagglutinin and neuraminidase surface proteins. On the left, this diagram shows a healthy lung, and on the right shows a lung infected with pneumonia. Pneumonia occurs when the infection causes the air sacs in your lungs, called alveoli, and tubes in your airways, called bronchioles, to fill with fluid or pus. This can make it hard for you to breathe in enough oxygen.